Hello, thanks for joining us for this class on IBS and the pelvic floor. I am joined with Amanda Settle from Nutrition Wise. And IBS is a topic that people often don't, they get a diagnosis and they're not really told anything to do. They're just like, oh, that's just IBS. And patients are just kind of left on their own to figure it out. So, Amanda and I really believe a key component of treating IBS is working on both the diet aspect as well as the pelvic floor. So, her and I will be going through this today with you, and hopefully, you learn something new and can help you get symptom resolution. So, I am April Ritz. Here we go. I am a mom of four. I'm also a wife to my high school sweetheart, and I own Effingham Pelvic Health and Wellness, which is a physical therapy clinic specializing in obstetric as well as pelvic floor physical therapy, including bladder issues and, of course, with IBS, bowel issues. I am certified in both obstetric and pelvic health rehab, and that's just a picture of my clinic. We are located, both Amanda and we're located in Effingham, Illinois. And then there's a picture of my team on the bottom right.
All right. Hi, everyone. My name is Amanda Settle. I'm a registered and licensed dietitian. I am the owner of Nutrition Wise, a private practice here in Effingham, Illinois. But I also do see patients virtually, and I'm licensed in 4 states as of right now and soon to be more. So I do have that virtual component with my practice. I have another dietitian, Lindsay, who works with me, and she specializes in eating disorders and disordered eating. And I went through the Monash University training for health practitioners, specifically for the low FODMAP diet for IBS. So that was kind of an additional training that I did just to kind of specialize me a little bit more in IBS. You can see my family there. So I've got my two kids, and so they are my life outside of work.
All right, Amanda. So why don't you start us off with what is IBS?
Sure. So IBS is kind of one of those things that it's called a functional bowel disorder. So it affects quite a few people, 7 to 15% of people worldwide. Unfortunately, though, it is very underdiagnosed. And what makes it tricky to diagnose is that there's not just kind of one or two tests. There's no blood test. There's no colonoscopy, anything that is a specific test to test for IBS. It is really more the elimination of everything that it is not. And it's kind of almost like that catch-all diagnosis of, well, it's IBS. Now, we will be going over some diagnostic criteria to diagnose IBS, but unfortunately, it is very underdiagnosed. It is more common in women than in men. And it's usually diagnosed before age 50. Not to say that it is not diagnosed afterwards. I've certainly had patients who are kind of newly diagnosed after age 50, but usually kind of starting around like age 20, 30 is a lot of times when it was when people go in for that diagnosis. Yes, like I said, it's kind of the elimination of other things that it is not. There are a lot of similarities with other GI disorders. So a lot of times there is a little bit of overlap there. So sometimes it can be a little bit tricky to diagnose. And with IBS, it affects the large intestine versus some other gut diseases that can affect more of the small intestine or even the stomach as well. Okay. So what causes IBS? This is still a little bit tricky because there's no kind of like one thing that causes IBS. There can be a genetic component, but again, it's kind of a little bit multifactorial. So there can be, it could, be some sort of change in GI motility, hypermobility, things like that. It could be a result of inflammation. It could be maybe even kind of more of there's also like a mental component. So maybe some stress or anxiety could have been the cause. So there are lots of different things that can cause it. Intestinal permeability. So what that means, if you've ever heard the term leaky gut, that is another thing that can really impact it.
I also want to say with like IBS, you kind of mentioned the mental component of it, but in the clinic, most people have heard of like your gut is like your second brain, like the gut brain connection.
Yes.
And almost all of my patients, we can go back as we talk and find something in their life that was super stressful or life changing that happened right before they started having the symptoms of IBS. So
Yeah.
that's always, I mean, if you guys are dealing with symptoms, kind of think back and be like, what happened in my life around that time that could have been a trigger for my body to start having some of these problems?
Yes.
So, what are the symptoms? Um, you have to have abdominal pain, and it's often associated with defecation or bowel movements, as well as altered bowel habits. So, this could be diarrhea or constipation. Pain typically improves after having a bowel movement. We can see changes in stool frequency. So, how often you're having a bowel movement. Ideally, we want a daily bowel movement. Abnormal stool type. Amanda will show here on the next slide the Bristol stool chart and the different types of bowel movements we can have and where we should be on that chart. We don't want hard and we don't want loose. Sometimes people experience straining with it if they're having constipation. Strong bowel urgency typically goes more with the diarrhea component. Incomplete emptying of their bowel movements. They go to defecate, but they feel like they don't fully get everything out. Some people will get some bloating, and then the symptoms can be worse during the late luteal, which is after ovulation, and during the menstruation, like the actual period aspect of the menstrual cycle.
Okay, so diagnosing IBS. So there are, like I said, some criteria, and a lot of that has to do with utilizing this Bristol stool chart, or as a lot of my patients fondly refer to it as the poop chart. And this actually lists the different types of bowel movements. So this is something that I go in depth about with my patients because it really does kind of let us track progress when we're working with patients to see, can we kind of get to that ideal type 4 stool type? Really, anything between a 3 and a 5 is considered normal. Ideal is kind of that type 4. So when we look at symptoms, we're going to utilize it's called the Rome 4 criteria. And that talks about how frequently these certain types of bowel movements are happening. There are some labs that we can look at too, including a CRP, which is a C-reactive protein, which looks at inflammation. Other nutritional markers, celiac screening is one. So we definitely want to rule out if it is, in fact, celiac disease versus IBS, although people can have both. The fecal calprotectin, that kind of looks to see, is this something more of an inflammatory bowel disease like Crohn's or ulcerative colitis? Getting a colonoscopy. Also looking at like gut microbiome testing, that's another thing that we can look at. We can look at fecal short chain fatty acid testing. We can look at food intolerance or food allergy testing as well, and intestinal permeability testing. So we're also kind of looking to see, and like I said, ruling out some of the things that maybe it could be besides IBS. One of them is SIBO, or small intestinal bacterial overgrowth. The difference between SIBO and IBS is that SIBO happens in the small intestine. So that's something that, but a lot of the symptoms are very similar. And when we are treating both, we are utilizing that low FODMAP diet for both.
So there are different subtypes of IBS. So there's IBS-C, which is constipation, IBS-D, which is diarrhea, IBS-M, which is mixed, and then some people just get like an unclassified diagnosis. Typically, it's one of those first three on the slide. So IBS-C is whenever at least 25% of your stools, at least 25% or more, are the type 1 and 2. So the first two on this Bristol stool chart, so like separate hard lumps, I call them little rabbit turds, or lumpy and sausage-like. Um, and then with IBS-C, you also have to have less than 25% are type 6 or 7. Okay. So more than 25% are 1 and 2, less than 25% are the 6 and 7. IBS-D, diarrhea, more than 25% of your bowel movements are loose. So those type 6, 7 stools. And then IBS mixed, you need more than 25% to be loose and you need more than 25% to be hard, like 1 and 2. So that is like the different subtypes based off the stool chart. Amanda touched on this some earlier, but it is a diagnosis of exclusion. So we do need to rule out irritable bowel or inflammatory bowel disease, which is like Crohn's, ulcerative colitis, um, IBD, so inflammatory bowel disease, can lead to IBS symptoms of like abdominal pain. So you really need a good provider on your team to help you get to the underlying root cause and what's truly going on with your gut. And as Amanda said too, with IBS, you definitely need to rule out SIBO because they present very much alike. And you also want to rule out like H. pylori and peptic ulcers. So that's where you can get more of the more specific testing and blood testing done as well. Sometimes you will need an endoscopy or colonoscopy to help rule out things as well. So here's just a difference. Sometimes this can be confusing for people, IBD versus IBS. So this is just a slide that kind of goes through the differences. If we look at the right of this chart, the IBS, it is classified as a syndrome, okay, or a set of symptoms. It's non-inflammatory, whereas inflammatory bowel disease has underlying inflammatory markers. IBS rarely requires hospitalization or surgery. It doesn't cause permanent long-term damage to your intestines, and exams and imaging will not pick this up. And it does not increase your risk of colon cancer. And diet is the primary treatment. And I'd also add in pelvic floor physical therapy, which I will explain more on that in a little bit. Whereas Crohn's, ulcerative colitis, it can cause permanent damage. People often get hospitalized and or need surgery, and it does increase your risk for cancer.
Okay, moving on to treatment of IBS, which is probably why you guys are here. So this is, you definitely want to take like a multifactorial approach when it comes to managing your IBS symptoms. There is no treatment for IBS, but rather tools we can use to manage our symptoms. So a lot of different things we can do, and they're all very important. So obviously, top of my list is nutrition therapy. There is a very specific dietary protocol for IBS. A lot of doctors don't even know that this exists. So this is something that really identifies what your true triggers are when it comes to kind of what is triggering your IBS symptoms. And I'm going to get into that in some later slides. Pharmacotherapy. So there is good evidence for use of antidepressants and antispasmodics for treatment of IBS symptoms. So certain antidepressants can kind of slow down the mind a little bit. So if you are someone that is like high stress, high anxiety, that can really be contributing to triggering some of those symptoms, especially with IBS-D. So the more the diarrhea type of IBS, whenever we are stressed or anxious, that kind of speeds up that motility in the gut and can worsen symptoms. There are some other medications on the market as well for treatment of IBS symptoms, both for IBS-C and IBS-D. There are some more natural things too, as far as things like probiotics, digestive enzymes, and also just looking at other things like your fiber intake. Lifestyle change is another big one. So making sure that you are getting things like exercise, plenty of rest, managing your stress. Those are also very important. Supplements, like I said, things like probiotics, digestive enzymes. Sometimes too, one thing we really have to be concerned with IBS is that sometimes we're restricting our diet too much, trying to find things to eat that don't trigger those symptoms. So sometimes supplementing even with certain vitamins and minerals if there is a deficiency. Psychological therapies, absolutely. If there has been any kind of trauma, a lot of stress, anxiety, depression, all of those things, like April said, our gut and brain, there is that gut-brain connection. And a lot of those things can trigger IBS symptoms. So if there are a lot of underlying issues, then seeking out therapy is definitely something that I recommend as well. Biofeedback therapy, that's something too, kind of more like pelvic floor related. April's going to get into some of that. And same thing with the physical therapy. So all very important components with managing those IBS symptoms. So, um, lifestyle changes, obviously, like I said, the primary thing I'm going to talk about is our diet. So, 95% of known food allergens are from 6 common foods. So, sometimes even just doing a standard elimination diet, if we're not sure if it's actual IBS or not, sometimes just doing a standard elimination diet of things like wheat, cow's milk, soy, those are kind of the top three. Other three are corn, eggs, and peanuts. If we do know that it's actually IBS, then definitely kind of going the more low FODMAP diet route, which I'm going to explain in the next slide. Sometimes we need to do things like just smaller, more frequent meals. That way, if you do have symptoms, sometimes eating a lot of food at one time can kind of cause that visceral hypersensitivity, really kind of speed up that gut motility. Looking at fiber intake, making sure that we're getting plenty of fiber, avoiding things like caffeine, alcohol, especially things like gluten and lactose, which are high FODMAP foods. But sometimes even just avoiding those two big components can make a big difference, and reducing our overall sugar intake. So eating a lot of processed foods and a lot of sugar will worsen our gut health overall and can make a difference in symptoms. So, FODMAPs. So, what the heck are FODMAPs? So, FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So, what does that mean? It is basically some really fancy terms for carbohydrates. So, these are some very specific carbohydrates that are kind of known to trigger those IBS symptoms. So they're found in a big variety of our foods, mostly our plant-based foods. So again, our very healthy foods. So that's not to say that these are bad. It's just that the ones that are higher in FODMAPs are usually the ones that will trigger some of those symptoms. So when we look at things like the oligosaccharides, the fructans, and the galacto-oligosaccharides, or the shortened term is GOS. So a lot of times these are not really absorbed very well in the small intestine. So what happens is our bodies, when we have IBS, are really not able to break some of these molecules down. So they travel into the large intestine where they just kind of ferment. And that's what causes all those unpleasant symptoms. So like your gas, distension, the bloating, diarrhea, constipation, all of those really uncomfortable, unpleasant symptoms is because of the fermentation of these carbohydrates. So same thing with lactose. Lactose is another one that really even people without IBS, a lot of us have a hard time breaking down the lactose molecule because it is a larger carbohydrate molecule. So it causes, sometimes the body to pull water into the intestine to try to kind of dilute that out, that can result in a lot of like gas, bloating, diarrhea, things like that. Okay. So the low FODMAP diet. So this was created by Monash University, which is in the Australia, New Zealand area. So these are the people that are doing basically all the research on the low FODMAP diet. And the reason that a lot of people, like I said, a lot of doctors don't even know that it exists is because it was created, I think around like 2005. So not to date myself, but that was after I graduated college. So this is not even really something that I learned about in college, which is one of the reasons I went back and did some extra training on it later on in my career. So it is a 3-phase diet. And so the first 4 weeks, we do an elimination of all those high FODMAP foods. Then we do the challenge phase. So then the next 11 weeks of this protocol is where we reintroduce one carbohydrate at a time and in very specific amounts to see, okay, do we tolerate it at all? And if we do tolerate it, do we tolerate it in a small amount, a moderate amount, or can we tolerate a large amount? So that way we can kind of really see what your true dietary triggers are. And with a lot of the clients that I have worked with, a lot of times out of 11 different carbohydrates, there's usually only about two that are really the problem. So, but a lot of times we're eating a lot of these carbohydrates in combination together. And so it kind of feels like, well, everything I eat causes problems. But when we can really kind of silo all of these different carbohydrates, a lot of people then, so that last phase, the personalization phase, is where we can reintroduce these carbohydrates back into the diet, and kind of test for tolerance at that point. So then we're able to kind of liberalize the diet again, which is really nice. So when we talk about meal planning strategies, so again, this is something that I really go in depth with all of my clients because meal planning is something that can be very just another source of stress when you have IBS, because what I see a lot of is that my clients will kind of make one meal for themselves, one meal for the kids, one meal for the husband. It's just kind of like they feel they're making all different meals. So what I really help them do is to come up with a mealtime strategy where they can feed the whole family, but still be able to, accommodate their needs as well. So really working on, making a plan, having a plan in place, where we can have balanced meals, but with some of those lower FODMAP foods. But also too, making enough for leftovers. So it's not something that you have to cook every single day. So we can really kind of simplify things, find some things that are even more convenient to eat at times when needed, that are not going to trigger those symptoms.
So yeah, I can't highlight enough like the importance of working with like Amanda or someone who is specialized in IBS, like the diet component of it, because that alone is like a full-time job. Like learning all of that in the diet. In our clinic, when we have patients come in who aren't working with Amanda, we tell them the basics of low FODMAP, and then we highly encourage to work with Amanda. But what we've seen is that patients are like, no, I can do it on my own. And then they go to the store and they get overwhelmed looking at sauces and condiments and all the things. And then when we, as the therapist, are asking, okay, like, what are you doing for breakfast? Like, what are you snacking on? And then it typically comes up where, like, did you realize, like, that should be part of like the elimination phase? Like, you are eating honey every day, you know what I mean? Or like, or whatever it may be. So, as physical therapists, public floor physical therapists, our job is not to guide you through this low FODMAP diet. There's so much more that Amanda can, and her program is very specific to help you like get through this easily and not super stressed because stress just flares things up even more, which we don't want. So, yeah, definitely. If you guys are dealing with these symptoms, you need her on your team.
Thanks for that, April.
You're welcome.
So yes, and kind of so again, kind of continuing what April was saying, other lifestyle factors that we really need to think about, and this is, I let April to obviously take care of all of kind of like the exercise and pelvic floor physical therapy side of things, and kind of on that note, it's kind of the same in on my side of things as well, where basically the patients that are seeing both of us simultaneously progress much faster in their symptom management. So I always very strongly recommend that all of my IBS patients also be working with April's team at the same time, because they will progress much quicker than if they do one and then the other, vice versa. But the other things that I work on with my clients is number one, stress, managing stress. Again, their lack of sleep, high stress, history of abuse, are highly prevalent in people with IBS. So sometimes there is, like I said, some kind of underlying trauma, stress, something like that. So really talking about things like mindfulness, anything to kind of slow down the mind, and that might include some like light movement, like even taking a walk, doing some yoga, even some breathing exercises, meditation, things like that, that can really kind of help. Again, if there is a lot of underlying anxiety, trauma, things that maybe need to be dealt with on a higher level, I do refer out to an actual therapist. Sleep deprivation. This is something that I really honestly have to work on with almost all my patients, whether they have IBS or not. So many of us just really kind of put sleep on the back burner at times, and that is one of the most important things that we can do for our overall health, because when we are not getting adequate sleep, we are usually not making the best diet choices. We are usually highly irritable. We don't have the energy to exercise. So there are a lot of things that come with sleep deprivation. So getting adequate sleep is highly important. Some of the herbal things that can be used to help manage some of those IBS symptoms are things like peppermint oil, St. John's wort, ginger, and turmeric. I do recommend, though, before you start any herbals, is to make sure that there is no interaction with any current medications that you're taking. Okay, and then talking about just some resources. So there are a few apps. Number one, well, first I want to say there are a lot of low FODMAP diet apps out there. Not a lot, but there are several choices. And I will say I have looked at, tried several, and none of them are as good as the Monash app. And again, the reason being that those are the people that are doing all of the research on the low FODMAP diet. So that app is going to be your most up to date. There is an $8 fee, but it's just a one-time fee. And I tell all of my IBS patients it is the best $8 you will ever spend. So, and that's one that I actually use when we're going through the reintroduction phase of the protocol. So that's one that I use with all my patients. The other one that is pretty good though is FODMAP friendly. That is a very good app as well. Just not my favorite. Again, I still lean towards the Monash. The other one over there is called the Nerva app, and that one goes through some like guided meditations, breathing exercises, things like that. And it is designed specifically for people with IBS. So that's another really good one. Other resources to utilize are some of your specialists. So, your GI doctor, a registered dietitian, and like a therapist or counselor, and of course, pelvic floor physical therapy. Now, to find a registered dietitian that is Monash trained, you can go to either the Monash website or in the Monash app and actually find dietitians in your area that are Monash trained so that you know that that is someone who is specialized in IBS.
All right, so now we go into more of like the exercise component and pelvic floor physical therapy. So, research has shown that with IBS, exercise can help reduce pain. So there was a study done of patients who walked for 30 minutes on the treadmill 3 times a week for 6 weeks, and they had an improvement in their IBS symptoms, less severe symptoms. So we all know, well, I don't know if everybody knows, but as a physical therapist that does a lot of movement work, exercise and just walking and being up and moving improves our anxiety, reduces depression, improves our mood, and overall IBS symptoms. Also, the more you move your body, it will help your bowels move. So, especially if you're dealing with IBS-C, constipation, one of the first things I deal with patients in our clinic who have constipation, I'm like, what's your activity like? How many steps are you getting a day? So, if we could just, if you're wearing a trackable watch, look at that. We need to aim for at least 10,000, if not more, but see what your average is and then just slowly work on increasing that and trying to get a walk in. That can be really helpful. And that's super simple. That's good for our gut health, but also our mental health. So here on these slides, the left shows a picture of our abdomen. We can see in the middle is the small intestine, and then like the upside down U organ, that is our large intestine. Um, on the picture on the right, this is a view from the side. We have, these are the muscles. We have our diaphragm on the top, that's a top dome. The very bottom from the tailbone to the pubic bone front is the pelvic floor. The fan-shaped muscles is your deep core muscles, the transverse abdominis. And then along the spine, you see little, like kind of like a ropey muscle. Those are your paraspinals. So those four muscle groups make up your core. And those muscles play a huge role in affect the small intestine and large intestine that's housed inside of those muscle groups. So people often think, what is pelvic floor physical therapy? What do my pelvic floor muscles have anything to do with my small intestine, large intestine, abdominal pain, all of that? So, what I like to say, your intestines inside of your body are very close to each other. So, if you think of like your neighborhood, there's houses sometimes in big cities that literally you can like put your arms out and touch both buildings, or condos are right back to back to back. Okay, that's how our intestines and our body are, they're all next to each other touching. Okay. We are out in the country in a rural area that's like a lot of space between. Your pelvic floor muscles are underneath those organs supporting everything. If we have sometimes IBS causes pelvic floor dysfunction. We don't really know like what comes first all the time. Sometimes pelvic floor dysfunction and tension can cause IBS symptoms. Okay. So if we say we're in town and our neighbors are having a big party and they're loud and they're noisy, the people next door are going to get a little bit upset. They might start to get angry and cranky if it keeps happening. Okay. So those pelvic floor muscles that are on the bottom start to be like, I don't like all this pain. I don't like this noise. And they start to get cranky and irritated. Same thing. If our pelvic floor muscles are tight, it can make the neighbors above it, the intestines, angry and irritated. Okay. So it can be this like cycle loop. What we often see with pain is muscle guarding. So if your abdomen hurts frequently, our muscles start to guard and protect it because it doesn't like the pain. With that, our pelvic floor muscles tense up to protect it. We get reduced blood flow to those muscles. When we get reduced blood flow to those muscles, they get more irritated. They're not getting a good like nutrient supply. They get ischemic, and they get even tighter. Okay, so it's this like thing we have to address. So your pelvic floor muscles on the bottom here, that has several main roles, but one of the main functions is bowel control. The pelvic floor muscle, the sphincter has to, I should have brought my pelvis in here, but the sphincter, there's a sphincter around your anus. It's your external anal sphincter, and it has to be able to contract. So we're not just letting poop come out all day and pooping our pants. And it has to be able to relax in order for us to have a bowel movement. In the clinic, what we see sometimes with patients, I had a patient yesterday with this, is that they cannot relax that sphincter. It is holding tight because it's been guarding against pain. It's not a happy neighbor, it's angry. So it holds tight and it's hard to let it fully open and relax to let the stool out. Or if you're having chronic diarrhea, our rectum's not meant to hold loose stool. So that sphincter has to squeeze even tighter to not let that like seep out and get fecal smearing. Okay. So we have to work on the pelvic floor muscles to get them to relax and not hold tension. And then also the nervous system component is so big. And most women, so IBS is more common in women. It can happen in men as well. But most women hold their stress and their emotions in their pelvic floor muscles. There's been studies that have shown that. A lot of people realize like tension in the upper traps, but that's actually like one of the second most common muscle groups. It's the pelvic floor that holds most tension and stress for women. So we have to learn how to breathe properly, let go of those muscles, and get good coordination. Another condition is called dyssynergic defecation, and that is when those muscles with when we're going to have a bowel movement are tightening up. So we literally retrain the pelvic floor muscles on how to pee and poop. Okay, so that's what we do in physical therapy. Um, Typically with IBS, it's not a strength issue. We're not working necessarily on Kegels and strengthening the pelvic floor. So if you have IBS, before you just start doing Kegels, because that's what people are told to do is just strengthen the pelvic floor muscles, do not do that. See a trained pelvic floor physical therapist who specializes in bowel issues. Because a lot of times we need to work on relaxing those muscles and then working on the coordination. So I explained like kind of how the muscles work. Those sphincters have to hold and then they have to relax. Um, and when we have a bowel movement, our body like produces some pressure downwards to help those muscles relax as well. If you have dyssynergic defecation, we talked about, where your muscles like actually want to tighten instead of relaxing on the toilet. If you're listening to this and you're like, I wonder if that's going on with me, you may feel like you're pushing against a solid wall. Like you're trying to have a bowel movement, but you're pushing against a wall and it won't let go. Okay. So often in our clinic, what we're seeing is people with abdominal pain and tenderness, bowel leakage. That goes more with our IBS D patients with diarrhea, and then dyssynergic defecation. Other symptoms that can go with IBS that we see often associated is back pain, pain with sex or sexual intimacy because the muscles are holding tight, urinary frequency or leakage. Again, muscles can be holding too tight, or erectile dysfunction in men. So with pelvic floor physical therapy, of course, like Amanda said, we both do a good job, I feel like, of addressing stress and sleep. Um, but then in therapy, we're focusing more on bladder and bowel issues that could go with it as well. Food diary, that's going to be more of Amanda's job of looking at that and figuring out, okay, yes, you are more sensitive to this food than this food. And then we're treating the impairments. Physical therapy is hands-on, working on the musculoskeletal system as well as the nervous system. So if there's any abdominal scars, pelvic floor scars, whether that's C-sections, hysterectomies, perineal tears from prior childbirth, we are palpating the abdomen. We find a lot of times people are holding, because it's so painful, they're holding a lot of tension in their rectus and their abdominal muscles. So we can do dry needling for that. We're looking at the hip and core strength. If we have weak hips, our pelvic floor tightens to help stabilize our body more. We look at the pelvic floor function, which we've already mentioned, and then exercise to help with stress reduction as well. Um, some individuals with IBS, they're often, if they have the IBS constipation, they're often experiencing difficulty emptying the bowels. They may have pain in the pelvic region, not just with bowel movements, but throughout the day from repetitive, like straining for constipation or holding in those muscles all the time so we're not leaking from diarrhea. Often, if there's constipation and they're straining, we can get pelvic organ prolapse. And then sometimes we just have anal incontinence where they also can't hold gas. So they can't hold their stool and they can't control their gas either. And those are all things that pelvic floor physical therapy help with. For IBS-C, when we have like abdominal pain, our stools aren't coming as frequently as they should. And sometimes people even get like a rectal pain or anal pain. We want to address all those things with the manual work we just kind of talked about for your abdomen and your pelvic floor. But some basic things you can start doing at home is ILU massage. So this picture here shows ILU massage. You start on your right lower quadrant by your hip bone, and you're going to come up as an I, and then you come up and over as an L, and then down as a U. What I'm going to recommend is going to our YouTube channel, Effingham Pelvic Health, and you can search for ILU massage, and I have I think it's like a 5 or 6 minute video really going into the specifics on how to do this massage properly. A squatty potty can be very helpful. It helps our pelvic floor muscles, our puborectalis relax better so we can empty better. Making sure we're drinking plenty of water and really watching other fluids because most other fluids can cause more bladder irritation, or if there's a lot of sugar, more constipation issues. And then exercise, which we talked about exercise. So just start walking. And the big question is like, will I get better? The answer is yes, you can. Okay. This may seem like a lot, like, oh goodness, this is like, I can't do all these things. Start somewhere, get a provider on your team who could keep you accountable, which is huge. Because I know so many people who are like, I think I can do this by myself. And then after 2 weeks of going by themselves, they start to fall off the bandwagon and they're like, this is too hard. I'm not seeing improvements. So work with Amanda, work with myself. If you're not in our area or in our state, like Amanda said, she can see people in 4 different states. I can only see people in the state of Illinois. But find, like she said, the Monash app, find a dietitian who is certified in Monash, or find a pelvic floor physical therapist in your area. You can go to Pelvic PT Rising, and they have providers who are certified and trained, not necessarily just in IBS, but in pelvic rehab. And APTA also has, if you search Google APTA PT locator and type in your zip code, you can find physical therapists who specialize as well in pelvic rehab. So you have to address all the underlying contributing factors. If you do all this, but you don't manage your stress, you're not going to fully resolve your symptoms. So take care of your mental health as well. So I'm gonna let Amanda. So we shared a couple testimonials, and like Amanda said, it's great working with both providers at the same time, you're going to get better faster, in our opinion. Um, but this is a review that Amanda had on her website. I'm going to read it for her. But so for the first time in over a year, I am able to work out again and no flares either. It put a smile on my face. I wanted to thank you for all your help and encouraging me to keep going with my nutrition even when it was hard. And then
Yeah.
you'll go
Oh, I
ahead,
was just gonna
Amanda.
say this is just kind of a great example of kind of like why I do what I do and why I'm passionate about working with people with IBS, because it really impacts their quality of life. And so on the next testimonial, that first one, it was a young girl in her 20s, and her IBS, she had IBS-C. It was so bad. She had to quit her job. She could hardly leave the house because she was in so much pain all the time. And so one of her goals was just to be able to go to a family function and get a job. And by the time we were done working together, she had applied and been accepted for a part-time job and was able to go to like family functions. And just it really just kind of changed her life. And the second one, on that same in that same square, she was a marathon runner, and it was very hard for her to train for marathons because she literally said she's like, I have to choose, like, choose my path based on bathroom stops. And so it was so amazing to hear her tell me, I am not waking up in pain and I can make it through a run. So sometimes it's just those little quality of life issues that just make such a difference in our patients, and why April and I do what we do.
Yeah, I remember for that testimonial on the right side, that was a mutual patient of ours. And I remember like she struggled so much with mental health when she first came in. And by the end, she was doing so much better because, yeah, if you can't work, you can't leave your house, you feel like crap all the time, like your quality of life is so bad. And so, yeah, I totally agree with Amanda. Like, this is why we do what we do to help people. Yes, nobody wants to talk about pooping issues. Nobody wants to discuss that. Amanda and I are all for it. Like, we're the only professionals that I know that are like, yes, tell me your Bristol stool chart number.
Yes.
Like, nothing's TMI for us. And then these were just a couple testimonials that we had off of our website. Um, so for Effingham Public Health, I highly recommend EPHW for anyone having issues with constipation or other complications. Both Kyla and April are very knowledgeable and use a gentle approach when treating you. My issues with constipation have cleared up with the therapy I received. Don't put it off. Call them today, set up your appointment. And then another one, I was referred by my family doctor for leakage. I so reluctantly decided, I think everybody reluctantly calls our office. I don't really necessarily want to come. I so reluctantly decided to go, thinking that there's no way this is going to help. When she started talking about breathing, I thought, yeah, right, she's crazy. I went in a non-believer and came out believing. She really does know what she's doing. It does help if you do the work. And that's the thing. If you're going to invest in this, you have to do the work. It's not a simple pill that you can take. That's not going to fix you. So if you are listening to this and you're like, I definitely need to take control of this. I'm tired of living with abdominal pain or bloating, and feeling like and just off. Here's our numbers for nutrition wise in our clinic. We do not need referrals. You can just call us directly and we can get you scheduled. Yeah, reach out to us. We'd be more than glad to help you. Amanda, any last words that you want to say?
I was going to say, I also have a website. It's becomenutritionwise.com. I'm also on Facebook and Instagram at become.nutrition.wise. I also have a private Facebook group for women with gut health and IBS issues. So those are just kind of some other ways. I know, April, you can share your socials as well. And sometimes that's just a good way to kind of get an introduction as far as kind of some of the things that we talk about and teach our clients.
Yeah, so we also, our website is effinghampelvichealth.com. We are on Facebook, Instagram. I do have a YouTube channel as well. And Amanda has a podcast too. I don't think
Yes.
you mentioned that.
I did not. It's the Nutrition Wise podcast.
Yes. So there's all the different ways to contact us, follow us. Our clinic does have a private page as well, and we do ask if you join that page, you're within like an hour to 2 hours radius of Effingham, Illinois. But that is Effingham area pregnancy, postpartum, and pelvic health support group, and it's for women only. So yeah, find those groups, and we just appreciate you listening. And you can get better. Just sometimes it's just knowing that there is help out there and having the confidence and believing that it will work for you. So thanks for listening.
Thank you.